Okay, so I want to welcome everyone. My name is Dan Martin. I'm the Safe Community Coordinator for the Village of New Lenox. So thank you so much for being here. This is our One Fall Could Change It All. This is our virtual presentation this year. Typically, this is an event that we do in person with a number of organizations and exercise demonstrations and a breakfast for seniors. But because of COVID, we had to do it this way virtually this year. So we're very grateful to have this opportunity to do this. On behalf of the Village and our Safe Community Coalition, thank you for joining us. For those that are unfamiliar with our Safe Community Coalition, we've been around for about 11 years now. We have an accreditation and also a reaccreditation as a safe community, which is a very prestigious honor, so we're very grateful to have that. We basically study injury data. We look at the data, which tells us where our citizens are becoming injured, and we try to create programs to reduce or eliminate those injuries and deaths. So that is done by way of task groups. We have a number of task groups. One of them is motor vehicle traffic safety, emergency preparedness, substance use prevention, suicide prevention awareness, and of course, older adult falls prevention, which this group falls under. So again, I'd like to thank our older adult falls prevention task group and our planning team that helped put this event together. They did a wonderful job putting this event together. The way this presentation will go today, I'll introduce our presenters here in just a moment. And then in terms of our Q&A, if you do have questions for our presenters, please use the chat box. And what I will do is I'll cut and paste the questions into a Word document, and then I'll facilitate the Q&A session at the end of the presentation. And then also, in addition to the questions that were put into the chat box, we will open the room up for verbal questions as well and for discussion. So at this time, I'd like to introduce our presenters. Dr. Shah is from Oak Orthopedics. He is fellowship trained orthopedic surgeon with extensive training in hip, knee, and shoulder disorders. Dr. Shah performs the latest procedures in orthopedics, including minimally invasive joint replacement, muscle sparing anterior hip replacement, robotic hip and knee replacements, and complex revision knee replacement. He continues to enjoy treating patients of all ages with orthopedic injuries and conditions, including fractures and trauma, as well as hand, foot, and ankle needs. Dr. Shah will discuss how to prevent falls and how injuries can be treated if a fall does occur. On a note related to Dr. Shah, he does have an emergency surgery that he has to get to very shortly, so he will not be part of the Q&A, but we thank him so much for doing his presentation. He will go first. Amanda Mitchell is from Joint Pro Physical Therapy. She is a physical therapy assistant who will discuss the importance of balance and how having good balance can help prevent falls. During her presentation, participants will learn about fall risk factors, how to protect yourself if you start to fall, how to safely get up after a fall, and how to help someone who has fallen. Amanda has been a therapist for 4 years at Joint Pro in New Lenox, where she works with patients who have a variety of needs, including orthopedic, balance, and sports medicine. And lastly, Seamus Hughes from Walgreens Pharmacy has been a pharmacist for 4 years. He grew up in Frankfurt and graduated from Lincoln Way East High School in 2010. He completed PharmD at the University of Iowa in 2016 and then moved to Kansas City after graduation. As a retail pharmacist, he is often the first person or first contact for patients when they are having health and medicine issues that could cause a fall and subsequent injury. One of the most common questions that he receives is, will this make me dizzy, tired, or interact with other meds, which is what Seamus is going to discuss during his presentation today. So again, I want to thank everyone, thank our presenters for being here today, agreeing to do this, and thank all of you for being here as well. And with that, I will turn it over to Dr. Shah. Thank you, Dr. Shah. There you go.
Can you hear me now?
Absolutely.
Well, thank you very much, Daniel. I appreciate that. It was a very nice introduction. Let me see if I can get my screen shared here. Can you guys see any of that? Yep, okay. So thank you again, Daniel. Hello, everyone. I'm Dr. Shah. Thank you for allowing me to speak to you guys today. I am an orthopedic surgeon. I am from this area. I grew up in Oak Brook. I went out to the East Coast where I studied mechanical engineering at Northeastern University in Boston, and completed medical school back here at Midwestern University in Downers Grove. And then I ended up doing my orthopedic training in Franciscan Health Systems here in Chicago, and then went on to do a fellowship, which is 1 year extra training in Los Angeles, California, where I studied how to do revision hip and knee replacement. I would say that this topic is very near and dear to me, as when we're on call, we tend to see a lot of hip fractures that come in through the door. And as a matter of fact, this is the reason I'm not able to do our Q&A today, is because I'm going to take care of one right after this presentation. So without further ado, just to kind of give a gist overall of what we're going to do today. So I wanted to just kind of give you a generalized picture and a generalized idea of what falls are, what fragility fractures are, what are some of the things we can do and put in place to prevent some of these injuries from happening. So as you might guess, as we get older, we tend to fall. Falls tend to increase with age, and the reasons for that are we usually have a decrease in our strength, a decrease in our reflexes, and as we age, we naturally start to have more comorbidities or other disease processes that can either cause neurologic or cause a decrease in strength, or the medications that we take for these various diseases may contribute to either dizziness or falling. So how common are falls? Vary. One in three people in our communities have been reported, and in nursing homes, unfortunately, it's been cited as high as 50% of people suffer a fall from standing height. It's been an enormous burden on the medical society, and the projected is that it's going to continue to increase over time. So if someone falls, what do doctors look for? I always look for, we kind of look for fractures, dislocations, head trauma, or brain bleeds. These can be especially problematic in people who are on blood thinners. So those are the common things we look for when someone comes into the emergency room. It really, there was something cited in the literature that this is costing around $31 billion our healthcare system. So it's definitely something that is that brings attention to us. So fragility fractures, what are they? These are defined as an injury or fracture in an individual resulting from minor trauma that should not cause injury to otherwise normal healthy bone. If someone suffers a fragility fracture, such as a hip fracture, they by definition have osteoporosis, which is essentially a thinning of the bone that happens in elderly individuals. 1 out of 10 falls, these individuals will cause a fracture. So who is at more risk? Women are definitely at higher risk as they have higher rates of osteoporosis, which is again that thinning of the bone, and that has to do with the normal aging process in women, where the hormones have an effect on bone remodeling and bone health. So something to note, I want to bring the attention to you guys, is the decline in function after a fall. So it's been shown that when people fall, they have a sharp decline in function. And anywhere between 25 to 75% of people never fully recover after they fall. So this is due to a fear of falling, or once someone falls, they feel like they want to become more sedentary and they're not as active. And that actually leads to a decline in function or a decline in that muscle mass or strength or the reflexes. And that actually exacerbates or makes the problem worse and puts them at even more risk for further falling. So risk factors I want to point out to you, older age, female, multitasking, people with decreased muscle mass, lower cognition, people who have blood pressure problems, such as there's a process called orthostatic hypotension we talk about in medicine. And that's when, as we age, our receptors in our blood vessel systems, they don't respond and adjust our vasculature as we were when we were younger. So when we go from a sitting to a standing position, we can get lightheaded very quickly and can suffer a fall just from that. Medications, especially for sleep or anxiety, such as benzodiazepines or amitriptyline, these are also for depression. These can cause people to become somnolent or drowsy and can contribute to falling. Musculoskeletal conditions such as arthritis. So if someone has a painful hip or a painful knee, or that can cause a fall, as well as neurologic issues such as Parkinson's, or if someone has some tremor, a neurologic tremor that they're dealing with, that can contribute to falling. And then finally, there's environmental factors. So things that are within our house that can contribute to falling, such as poor lighting, thick rugs, slippery surfaces, or cords, light cords or what have you, that can trip us up and cause us to fall. So can we prevent falls? Yes, the answer is yes, we can. The best type of medicine is preventative medicine. So how can we try to prevent these things from happening? Well, we can adjust the things that are in our environment. We can adjust our medication use. We can make sure that we're checking our vision. We can talk to our doctors and professionals and talk to them about a fear of falling if we have that. And physical inactivity, exercising for 3-4 hours a week is, I think, very important. Trying to keep your muscle mass strong and staying ahead of the curve. So there was an activity that there was a study that looked at modifications, and I wanted to highlight this because exercise was shown to be the best for fall prevention. If you've had a fall, working on strength and balance is very important. So both group and home-based exercises are very helpful. It's recommended that about 3 hours a week are found to be most effective. And interestingly, one exercise was very helpful in the study that I reviewed. It was Tai Chi. So that actually is an exercise that strengthens balance and muscle. And it was found to decrease falls up to 44% a year, which is fantastic. So why don't we talk about falls in the house instead of falling outside. So just to focus on that, again, you want to make sure you have proper footwear, handrails. You want to review your medications or what we call polypharmacy. So if people who are on multiple medications, you want to review that with your physician. Check your surfaces for any slippery surfaces. Removing these and ensuring you have grab rails, improved lighting, and checking your vision is very important. Footwear is very important. So poor fitting shoes or worn soles, high heels or shoes that are not laced are associated with falls. One study showed good footwear decreased falls in icy conditions, which is very important here in Chicago where we live. Winter is coming, so it's definitely a good time to check your footwear. Interestingly enough, anti-slip socks were not shown to decrease falls. So it's really just best to wear your own shoes and have proper shoes and check them to make sure that they're fitting properly. Next thing, you minimize your medications. So you want to review your medications with your primary care doctor. Again, if you're on a benzodiazepine or you're on blood pressure medications, understand that these can make you feel lightheaded, they can make you feel dizzy, and you should review them with your physician to see if that's something you can either decrease or eliminate entirely. Some other things just that are not as common that can put people at risk for fall. There's something called carotid hypersensitivity. It's something just to be aware of if you're being treated by a cardiologist for this. It's been shown that a pacemaker can be very helpful in fall prevention. So postural hypotension is something, again, I briefly went over that orthostatic hypotension when people go from a sitting to a standing position. So a way to prevent that is making sure you're well hydrated, wearing stockings that can help prevent lightheadedness, and hopefully prevent the fall. Cataracts, these have been found to be very helpful in fall prevention early on. So if people have cataracts, taking care of them early and having them removed is shown to prevent falls. Interestingly enough, it hasn't been shown to be quite as effective for a second or third or fourth cataract. Vitamin D levels. So vitamin D, interestingly enough, has been in the literature, and based on the most recent literature, one study suggested that if someone is vitamin D deficient, it may be beneficial to supplement the vitamin D, and that was suggested to aid in fall prevention. So if you see your doctor and you have low vitamin D levels, it's recommended that you should take about 800 or 1,000 units per day to supplement. And if you don't have low vitamin D levels, supplementing hasn't been shown to help in fall prevention. Again, not to harp on vision, but vision is very important to check and have assessed. I think it's very important to be careful after eye treatments. So it's not only important to address your cataracts and making sure that your vision is up to date, but also know that if your prescription is adjusted or if you have a procedure done, it's very important to be careful in those coming days after things were adjusted. One study showed that there's been up to 57% increase in fall risk immediately after an ophthalmic treatment. So it's, again, very important to be aware of that and take great care after an eye procedure or having your eyes, having your prescription adjusted. So what do you do if you do fall? Try to stay calm. Check to see if you're hurt. You can call out for someone around if anyone's near you, or if you have a telephone, access to a phone, call for assistance. If you think you can get up, do it safely and slowly. Seek medical attention or your doctor if you think you're hurt or if you hit your head. So this is sort of one recommendation of how to get up safely. Go slow, roll onto your side, allow yourself to adjust to the position that you're in, and allow your blood pressure to kind of normalize. And then you want to try to crawl over to a sturdy chair with legs, nothing that rolls or moves. And you want to try to get up by lifting 1 foot at a time, put your weight over the chair, and then sit down before trying to move anymore. So what can we do right now with your doctor? If you have a fear of falling or if you feel that you're at risk, you definitely want to go see them. If you've had a fall or afraid of it, or if you have difficulty with balance, again, get in to see your doctor to review your medications, especially the ones you're taking for sleep or depression. If you check your vision regularly and be aware of eye procedures in the adjustment period. You want to have your cardiovascular status checked with your doctor So if you're experiencing symptoms of lightheadedness, getting up from a sitting to a standing position, you want to bring attention to that and make sure you're well hydrated and see what steps they can put in place to, decrease those symptoms. And really a plan that is individualized for you is more effective than just a generalized plan. So if you have a partner or a friend and things are working for them, it may not work the same for you. So you want to take into account your medications, your vision status, your cardiovascular status, your shoe wear, your home environment, and really make a plan for yourself so you're not at risk. Even now, standing up, just taking the time to stand up slowly, allow your blood pressure to adjust, that can be helpful. Again, assess your home for hazards. Try to have grab rails when possible. Avoiding excessive tobacco and alcohol use is important. Alcohol definitely can contribute to falling. And interestingly enough, tobacco use has been shown to be associated with frequent falling. Again, check your shoe wear. Interestingly enough, it hasn't been shown in the data that using a cane or a walker prevents falls. But if you do use an assistive device, I would recommend making sure that you're using it correctly. And finally, I'll leave you with that exercise is probably the most helpful thing that you can do for yourself in fall prevention. And so that's all I have for you guys.
Dr. Shah, thank you so much for taking the time. That was an excellent presentation. And also I was given information, I know you have to go to a surgery, and I was given information that if anyone did have follow-up questions for you, they could contact your office directly. They would need to call 815-928-8050. That's 815-928-8050. And as for Tanya, which is your nurse?
Absolutely. We will be happy to answer any questions. And she can also provide you with a direct email address and that I can answer any questions you guys have moving forward.
Excellent. Thank you so much again.
You're very welcome. Thank you guys, and take care, okay?
Take care. Thank you.
Bye-bye.
Okay, so with that, now that Dr. Shah's portion is over, we'll turn it over to Amanda. Go ahead, Amanda.
Can you hear me?
Yes.
Awesome. All right. Well, thank you everyone for having me. I really appreciate it. As Dan had mentioned earlier, I work in a physical therapy clinic here in New Lenox. So I'm going to just talk to you about balancing and what to do if you fall, how to get up, how to help someone else. So can you guys all see my screen? We're all good? Perfect. All right. So falling down and getting up. Let's see if I can. There we go. So this is kind of what I'm going to be touching base on throughout the presentation here. So what is a fall? What are fall risk factors? I know Dr. Shah went over a lot of this already, so I'll just kind of reiterate what I can and then kind of elaborate on what's pertinent to physical therapy. So what to do or how to protect yourself if you start to fall, how to get up if you fall, and how to help someone else who has fallen. So what is a fall? Well, a fall is any event that leads to an unplanned, unexpected contact with the supporting surface. So a lot of times people think that a fall is only if you fall on the ground, but that's not necessarily the case. If you come into contact with something that you were not intending to, that is technically considered a fall. So what are some risk factors? Again, going off of what Dr. Shah said, I won't elaborate super deeply on these because he already did so, but weakness in your legs, a vitamin D deficiency, if you have poor balance or difficulty walking, certain medications, which I'm sure Seamus will be able to kind of take over and elaborate really well on those, vision problems, foot pain, proper footwear versus poor footwear. I do want to mention something else that just to kind of like go over what Dr. Shah was saying also is that I believe it is super important that as much as everyone loves those super comfortable house slippers that you have, you got to take those off and get something with a little bit better traction, something that keeps your foot safe. I can't tell you how many times that those things are just a fall waiting to happen. And so while they're comfortable and cozy and winter is coming, think about finding something that's a little bit better suited for your foot just to keep you safe. Other household hazards, I believe Dr. Shah discussed on this as well, but making sure that you don't have a lot of extra rugs around the house, throw rugs especially. I mean, you can just cut your foot on them so easily. Loose cords, you know, keeping them nice and close. If you have something plugged in, keep it nice and close to the wall. If you've just cleaned the floor, you want to stay away from, you know, walking on a wet floor. Plus, you don't want to mess up your floor, so that's also important. But those are some things to think about. Plenty of other things regarding that, but I'm not going to keep reiterating what Dr. Shah said. So those are all things that are risk factors. There's certainly more. Just because you have one of these things doesn't mean you're going to fall tomorrow, but studies have shown that the more risk factors you have, the higher likelihood you will have of falling. So, you know, keep this in the back of your mind. See if you're, you know, checking any of these off the list. And if you are, then, you know, talk to your doctor, maybe come to physical therapy, see what we can do to help you before you fall. So what do you do to avoid falling? Well, you want to keep a wide base of support. I like to tell people to think about if you're walking outside and it's icy out, typically you don't like keep your feet super narrow and walk like a scissoring pattern. You kind of keep your feet out nice and wide, and you slowly move, and you keep your base of support wide. So it's just helping to keep you protected a little bit more. If you have a narrow base, if you think about something that is even out in the wind, if it has something narrow and the wind comes and like pushes it, it's going to fall right over. But if it's sturdy and it has a nice sturdy base, then it's going to be a lot harder for it to tip over. Same thing for us as we're getting around in the community or in our home. If you start to feel unsteady, I want you to think about moving toward a wall. Moving toward a wall is very important because it's just something that you can hang on to. You want to, if you don't have a wall nearby, you could look for a steady piece of furniture. I would caution you to make sure that it is a very sturdy piece. You don't want to be reaching for your kitchen chair that might have wheels on it, or something that's a little bit tipsy. So something that's really steady, but ideally moving toward a wall, because hopefully your walls aren't going anywhere. So what to do if you start to fall, you want to use your hands. There's two ways you can do this. You can do one way by protecting your head. So the biggest thing is you don't want to hit your head. So you can do that by protecting your head, or you can use your hands to kind of slow yourself down. This kind of matters based on if you're falling forward or backward. And it's kind of hard to think about all of that in the moment when you're falling. It kind of happens quickly and it's very disorienting, but biggest thing is use your hands to try and protect your head. If you do fall, you want to fold your body in like an accordion just to kind of protect yourself, almost going into that fetal position. I don't know if you can see in the picture here, but going into a fetal position, it just helps protect your body. You want to make sure that if you're coming from a height, like if you're falling off of something, you try to roll as you're hitting the ground, rather than just falling down as best you can. Like I said, it happens quick, so I'm sure it's hard to think about all of those things in the moment. So say you're on the ground, what do you do if you get up, or how do you get up? So first things first is you need to, I don't know if you can see, I know these pictures are kind of here. I don't know if we can hide this. There we go. So first thing is, in figure number 1 right here, I don't know if you can see where my cursor is, but first thing there is that you want to just kind of assess what's going on. Wiggle your feet, wiggle your hands. Are you feeling okay? Did you hurt yourself? Is anything hurting? Did you hit your head? Just kind of assess how you're feeling. Ideally, you would have a life alert on you, or a cell phone, or some way of contacting someone if you needed it. I highly recommend if you're living alone or you're alone in your home and you're at risk of falling, that you always keep something on you to reach out to someone if you need help, you know, because the last thing you want is to be stuck on the floor and you can't move and you can't call anybody. If you are feeling okay and you're feeling like you can move, you want to think about if there's one side that you hurt, like say you fell on your right side, you want to try and kind of roll onto your left side. But before you even get to that point, I want you to look around your room. Do you have a sturdy piece of furniture? Do you have stairs? Is there something that you can like visualize and crawl to that you know that you can use that to help you get yourself back up? So then once at that point, in figure number 2 here, you'll roll over onto your side, ideally the side that's not hurt. So, you know, like I said, if you hurt your right side, roll over to your left or vice versa. At that point, you're going to kind of roll onto your hands and knees, as you can see in this picture in number 3 here. So when you're doing that, I have a lot of people that say, well, I had a knee replacement and my doctor said I can't crawl on my knees because I had a knee replacement. Yes, generally that's the case. However, if you fell on the floor, your safety is the #1 priority and you need to make sure that you're able to get up and move. And so, you know, the little bit of time that you're crawling on your knees, and no, it's probably not going to be the most comfortable thing, but it's much better than laying on the floor, to be quite frank. So you want to make sure that you're doing that, you know, knee replacement or not, you need to get yourself up and make sure that everything is okay. So, you know, for this situation, crawl if you need to. So you're going to crawl toward it, like as this gentleman is showing in picture number 3, he is crawling toward a chair because that's what's nearby. If you have stairs, that's perfect too. Then after that, you are going to use yourself to kind of help yourself up onto the chair. So you can grab the chair with both. Ideally, you would bring kind of one knee up in front of the other, almost like you'd be in a proposal position. You know, if you see someone propose to someone else, they're half on one knee and the other knee's back. That's kind of the position you would get into. And you would use your hands for support on that sturdy chair or stairs, but it has to be, it cannot move because then you don't want to be taking that with you. You need to make sure it's stable. At that point, then you would lift yourself up and then you would slowly turn yourself down into the chair. Or if it were stairs, you would actually back up your butt to the stair and then use your arms to lift yourself up onto the chair, which we can kind of go over in the Q&A if you guys would like to see that. But so once you're sitting, I want you to focus on just resting for a minute, take a few beats, see how your body's feeling. You know, take a little bit longer than you think you might need just to regroup yourself, because a fall can be very jostling to the body. So take some time before you decide to get up and move, and then go from there as far as, you know, calling someone or, you know, reaching out to your doctor or whatever. So again, kind of going over what I was just talking about. If you can't get up, ask for help, you know, 911, life alert, you know, any of those things. Don't call your child or nearby friend to come and help you. 911 is there to help you. So please feel free to do that if you need it, especially if you hit your head or you feel like you can't move something. Just as why it's important to have your phone or something on you at all times when you're by yourself. So how can you help someone else who has fallen? Well, first of all, if there's a loss of consciousness or they've hit their head, please call 911. Don't even, you know, you want to make sure that they're taken care of appropriately. We don't know necessarily what happened when they fell or what they hit, so it's just best to call 911. If you yourself are off balance or you don't feel stable, you should not be helping that person. The last thing we want is to have 2 people on the floor instead of just 1. So very, very important that, you know, you are in a position to help them, and don't feel like, you know, you're not a good friend because you're not helping them up. You're doing both of yourselves as a service by calling 911 rather than helping that person. Just staying with them is more than enough in the meantime. If you are going to help them and you feel like you're stable and you're secure, then you need to make sure that you're protecting your body too. Like I said, we already have one person on the floor. We don't need to have a second person that's also injured or you pulled your back. I can't tell you how many times I've had like husbands and wives where one helps the other one because they're falling and then they both end up in physical therapy because, you know, the other one hurt their back or, you know, did something to while they were trying to help their spouse. So really important to keep that in mind. If they're falling and you're kind of like trying to help them, try not to just like keep them up, but just slowly lower them to the floor. It's easier to just kind of lower them slowly and make sure that they're not hitting anything rather than trying to like keep them up or like hold them up. Finding a sturdy piece of furniture, again, this is going to help them get back up off of the floor. So maybe finding a stable chair, holding it so it's not moving for them. And then again, if you are helping them, you want to keep your base of support wide, kind of like when we were talking about earlier, when you're walking, if you feel unsteady, you want a wide base of support. The same thing for if you're helping someone. You want to keep your feet wide, and your hips wide. You also want to make sure that you're lifting from your hips if you are going to help someone, because if you're lifting from your back or you're using your arms, chances are you're going to cause some injury down the road, and that's not going to feel good. You might not feel it in the moment, but later on you probably will. So make sure that you're lifting from your hips, keeping a wide base of support, but when in doubt, call someone else for help. All right, so questions to ask yourself regarding all of this. So are you less fearful about falling? Going over all of these things, do you feel safe? Do you feel secure in your home environment? Do you feel confident about going out in the community? Are you exercising? Whereas Dr. Shah said earlier, you know, exercise is of utmost importance, and, you know, 3 hours a day, you know, or 3 hours a day, oh my goodness, that would be a lot. 3 hours a week is really important to keeping your body nice and strong. So are you doing that? Do you know what to do? Are you totally overwhelmed and you're like, I have no idea what to do. I don't know where to go from here, or I'm not sure what exercises would help me with my balance. That's kind of where physical therapy comes into play. So if you feel like you're not totally sure about any of that, ideally when myself or Michelle are at one of these events in person, we're doing balance screens on people. Unfortunately, because of COVID, it's a little harder to do that. So I know a lot of physical therapy clinics do like free injury screens. Our clinic is one of those. And so if you feel like you're not sure about your balance or your stability, you know, feel free to reach out to our clinic. We're more than happy to do a free injury screen on you, and we'll just do a balance assessment is basically what it would be, just to see where you're at, maybe give you a couple ideas on things you can work on and see if you need physical therapy, if you're a candidate for it, or if you just need some guidance. We're here as a resource for you, and all physical therapy clinics should be. And thanks to a new law in Illinois, you do not need a script from the doctor to come to physical therapy. So if you feel like you need physical therapy, we have direct access in the state of Illinois, so you are more than welcome to come to PT and start that just because you feel like it would be helpful to you. So think about that, and if you feel like you need a little bit more guidance or you need some help or you're not sure where your balance is at, those are all things that physical therapy can help with. So that is it for me. Let's see if I can get back to this. There we go. All right.
Amanda, that was great. Thank you so much. We loved your slides too.
Thank you.
Very nice. And we'll have some good questions for you, some great questions coming across in the chat box for the Q&A.
Perfect. Thank you.
Okay. Seamus, you're up, sir.
Okay. Can everyone hear me and see see my screen okay? Oh, I can't actually see if you're giving me a thumbs up. Hold on. It's good, Dan?
We don't see your screen just yet. We just see the chat box view.
Oh, let's try that again.
It's coming across now. There you go.
Okay. Sorry about that. Okay, so yeah, as Dan said, my name is Seamus Hughes. I'm a pharmacist with Walgreens. graduated from Iowa in 2016, and I currently now work in Kansas City, but I'm from the Chicago area, from Frankfurt, so grew up there my whole life. Goal of today's talk from my perspective, obviously as a pharmacist, is going to be medication specifics. Just a little overview briefly of what I'm going to discuss. Main side effects, which Dr. Shah had mentioned earlier as well. Go into a little more detail of what we're most concerned about with medications, what either increases the risk of falls and or increase the risk of complications from a fall itself. Then specifically what drugs cause those issues or are more likely to cause those issues, because as you may know or have seen, you get your medication from your pharmacy, and the little insert that comes with it is a 10,000 word essay on every side effect under the sun. And so after reading that, you may not want to take the medication. That being said, sometimes it's a bit of a coverall that anything reported in a procedure, or excuse me, in a trial, shows up on that. Certain medications, though, are much more prone to having those side effects than others. Then move on to alternatives, either reducing dosages, reducing risks, etc. And then lastly, just a little bit on prevention, mostly from, again, a medication standpoint, a few different things that can be done on that. So side effect wise, as you'd expect, the biggest thing is anything that causes a change in or disorientation, consciousness type things. So dizziness, drowsiness, particularly certain medications can cause delirium or delirious type side effects. People either become cognitively impaired or just don't, aren't fully aware of their surroundings. Dr. Shah had also mentioned orthostasis or orthostatic hypotension, which, as he discussed, is a drop in blood pressure from going from a sitting to standing position. Basically, the blood vessels in the body don't compensate quick enough. When you're young, you stand up, there's a quick constriction, which keeps the blood flow or the blood pressure adequate to the brain. And what happens as you age, or rather what can happen in some people when they age or just in general, is that doesn't occur, that response doesn't occur in a quick enough manner, which basically causes a drop in blood pressure, and as a result, you feel very lightheaded or dizzy. And then not necessarily a side effect, but increased risk of bleeding from particularly certain over-the-counter medications and blood thinners in general. In that case, it's intended, but you get an injury or a fall, that's going to increase the complications and or the severity of the injury after the fact. So what drugs should I be concerned about? If I'm going through my medication list or my grandparents or parents or spouse's medication list, what should stick out to you? Now, obviously you can come into your pharmacist, your doctor, go over these if you're concerned about anything. But if you ever want to go over them yourselves, there's certain ones that are, should stand out to you. So first, anything is what I classify as a psychoactive medication, or affects the brain primarily rather than working on other areas of the body. So benzodiazepine or benzos, which are generally used for anxiety. Rarely they can be used for people who have like alcohol withdrawal syndrome, or for seizure prevention or seizure treatment. But the majority of the dispensing that we see is for anxiety. Those are generally end in the suffix "pam," so like lorazepam, alprazolam, etc. Sleeping medications, which are very similar to the benzodiazepines, those are the Z drugs or Z hypnotics, as you'll sometimes hear. So zolpidem, zaloplan, zopiclone, or the brand names for those: Ambien, Lunesta, and Sonata, if you've heard of those. And those can be a particular concern because as you age, the body breaks down the drug at a much slower rate than normal. So what was once only going to last, 6 to 8 hours for sleep can now prolong onto or into the day. There's even reports with those medications, in particular zolpidem, that the effects of the drug can last. You wake up and you have complete amnesia from the first couple hours of the day, where you don't remember what actually happened, even though you were functioning. Opioid medications, which is obviously a hot topic with everything going on today. So strong prescription pain relievers. Most common ones you'd see would be oxycodone, hydrocodone, morphine, etc. Antidepressant medications. Dr. Shah mentioned one, amitriptyline. There's a bunch of different classes of these. The ones that are mainly concerning are some of the older drugs. The newer ones that have come around in the last 20, 25 years now are less of a concern, but still do have some of those issues that come with them. And again, like I said, you can always talk to your pharmacist or doctor about anything that comes up on these. Antipsychotics, which are very often used, I guess, inappropriately in nursing home situations, mainly as a sedative or to, I guess, keep patients calm who are, potentially have dementia and things like that. And there's kind of been a strong push to get rid of that, but the practice still is fairly pervasive today. But those medications mainly can cause delirium, drowsiness, etc. And then muscle relaxers, there's quite a few medications in this class, some better than others. Cyclobenzaprine or Flexeril. Very many people have probably been prescribed this in their life if they ever had a sore back or whatnot. The medication itself isn't super effective. It really just kind of makes you a bit tired and relaxes you a little bit. And that maybe helps relax the muscles, but especially in the elderly, and especially if you're on additional medications, can cause some issues. So to continue on this then, non-psychoactive type medications or just other drugs in general. Allergy medications are over the counter, and Benadryl is really the main thing to be concerned about. There's quite a few different antihistamines out there, but a lot of people will take Benadryl for sleep, and that's generally okay. As a general allergy medication, though, if you're taking it every day, wouldn't be my first recommendation, mainly because it has to be taken frequently, and it's at an increased risk. You're at an increased risk when taking it of having potential side effects, mainly impairment, drowsiness, and again, especially if you're on additional medications, that can cause that as well, that can kind of have an additive effect. So preferable drugs in that case, the once-a-day ones, your Claritin, Allegra, or Zyrtec for daily allergies, or even, I think I mentioned it later on, but even a nasal spray steroid, things like that. For incontinence, again, this is another area where similar to the antidepressant, the old drugs that they first had worked well, but had a host of potentially dangerous side effects. The newer ones are much more targeted and tend to work quite a bit better, but a lot of them are brand name only. Quite a few have gone to generic recently, but that's still going to be over the next 5 years or so that we'll see a lot of these costs come down. Doxazocin, Terazosin, Prazosin, the SIN ending is what you'd be looking for there. The orthostasis, or how they work, is on blood vessels and a certain receptor, and as a result, they're very crude in how they work, and thus they help with the urinary tract area, but they also work on blood vessels in the brain, which causes them to expand, and as a result, you make the pipe too wide. Well, now there's not enough flow of fluid going through there at a high enough pressure, and you get this issue from that. And the particular danger with that is that you're taking those, or most people have incontinence issues at night, or that's when it's most bothersome. So you get up in the middle of the night, you quickly get up out of bed, and you pop right up, and all of a sudden your blood pressure drops, and you you can potentially pass out and/or fall. Diabetes medications, insulin, mainly just from the standpoint if it's inappropriately being dosed, particularly sliding scale or when you reactively dose insulin rather than the new method kind of these days is proactively dosing based on carb levels. That can potentially cause issues if you give yourself too much and your blood sugar drops too low. And then the two other drugs I've listed there, glimepiride and glyburide. These are an older class of drugs as well, and they cause the body to release insulin, but they're indiscriminate about it. If you take these and your blood sugar is already low, it's going to drop even further. Whereas some of the newer agents work in response to food. They don't, you can only kind of have a floor of where you can go. You won't go lower than that. So those two are particularly dangerous in the elderly because they have a much longer duration of action, particularly with seniors as the metabolism of the drug decreases and thus it stays in your body for a longer period of time. And then lastly, I'd mentioned the blood thinners. So common one that's been around for ages, Coumadin or warfarin, clopidogrel, which is the brand name of Plavix, and that's been around for quite a while. And then we have some newer ones that have come on the market in the last 10 years. Eliquis, Xarelto, Pradaxa would be another brand name there. Like I mentioned earlier, they don't increase the risk of fall, but they can increase the risk of bleeding from that subsequent fall. Generally, warfarin is still considered the drug of choice for a lot of situations, mainly because it has what's called a reversal agent. If your blood is very thin and you're bleeding profusely and they can't get it to stop, they can give you vitamin K, and that reverses that. It brings your blood back to a normal thickness level, if you will. Whereas these newer drugs, there are agents that are being trialed, but they're not really fully out there for all of them yet. And so it can be a little more dangerous. Does the hospital have it in stock? It's very expensive, but if your life is on the line, it's not too much of a concern there. But just keep that in mind and make sure anyone who's on these medications that any doctor you ever go to knows that you're on these medications, because there's a whole host of interactions. I can't count the number of times I have to call an urgent care or anything like that, and patient was given an antibiotic and they have no clue that they're on a blood thinning medication, and there's interaction that can potentially cause or increase the risk of bleeding. So I mentioned earlier some alternatives for sleep-related issues. The number one recommendation is always going to be sleep hygiene. And what I mean by that, easier said than done, but reducing screen time at bedtime, dimming the lights, making sure that the room is how you want it, and just winding yourself down at the end of the night, avoiding stimulants later in the day, things like that, is always the first step. But obviously that doesn't work for a large percentage of people. Melatonin would be another thing to try, but problem always with that one for most people is what they tell me is they don't have trouble going to sleep. They have trouble staying asleep. And melatonin helps you fall asleep, but it doesn't keep you asleep. And so that's the main there. And that's why so many people resort to these prescription drugs. For anxiety, depression, alternatives to those benzodiazepines that I mentioned before, Buspar or Buspirone is one, and then you have your newer antidepressants, what they call the SSRIs or the SNRIs. Those drugs, less effective, particularly the cognitive impairment that can come with some of the other medications. For nerve-related pain, we have gabapentin, which can come with its issues, but much less so than, particularly than using like an opioid for that, for instance, Lyrica and duloxetine. And then I mentioned earlier allergies, using a steroid nasal spray, which are now thankfully over the counter in the last few years, such as Flonase, can be very helpful, not just for nose-related issues, but actually for whole face-related issues. So itchy eyes, watery, runny nose, those kinds of symptoms. The nasal spray actually will treat all of that. And then I'd mentioned the 3 daily antihistamines, Claritin, Allegra, and Zyrtec, and then eye drops as well. Again, another drug that just went over the counter called Pataday. is a eye drop that works quite well. Obviously, in this case, it's only going to be for eye-related issues. But if that's all you have, then that is worth a consideration if the others haven't worked as well, or you just don't feel like trying those first. So then lastly, on to prevention topics. Dr. Shah had mentioned earlier regarding osteoporosis. Obviously, women are at a much more increased risk of developing that. Regular screening and or treatment for that, so getting you on a medication that increases the bone density can reduce the risk of a fracture from a fall if it were to occur. As we've all stressed this last hour, regular exercise is arguably the most important thing, because if you're eating healthy and exercising regularly, you don't are much less likely to get into a situation where you have a fall. The vitamin D, taking it daily if your levels are low, has been shown, and mainly that is the reason for that is that increases your absorption of calcium. If vitamin D levels are low, your body actually doesn't absorb an adequate amount of calcium, and that's kind of the rationale behind that thought there. And then lowering dosages and or removing the offending medications that I've kind of gone over. But one of the most important things I would also say is that communication is key throughout all of this. Without you communicating to me or your provider or whatnot that the medication is causing issues, I have no idea that there's anything wrong. I dispense the medication to you and I think you take it, and if you don't take it, then I don't know that, and your provider doesn't know that either, and we wonder what is wrong, and it's very hard to figure things out sometimes. So in summary, I'd say communication is kind of one of the biggest things, and that's what I harp on here at the end. Like I'd mentioned before, many drugs come with potentially dangerous side effects. The biggest thing is there's a risk versus benefit analysis that has to occur, and I dispense drugs all day. I'm not advocating that we all stop taking medications because they're dangerous, but there's a balancing act that has to occur there. And when you don't communicate that you're having issues to your doctor, to your pharmacist, etc., it can be very difficult to sort that out. So anytime something's being changed, added, modified, whatever the case is, or you just have any questions, always ask. Especially if you're at your doctor's office and they want to change something, ask before you leave, because a lot of people will show up and they have no idea that they were prescribed something new, or they don't know what it's for. And I have to guess sometimes, because medications can be used for a variety of things, and that can make things much more challenging. And so if you're proactive about your own health, that makes things all the better. So like I said, communication is key. You're the ultimate, one in charge of your health. I can't make you take your meds or whatnot. One other thing I would mention, there is something called the beers list, like literally the drink, BEER. It's mainly for clinicians, so I don't necessarily recommend that you go and try and read it because it's a little bit wordy, but they release a list basically every few years of updates on medication risks, basically in the senior population, and what they have different levels of evidence and whatnot, what medications they recommend to be avoided, what medications are safe alternatives to that, etc. So that is everything that I have.
Seamus, that was excellent. Your knowledge of these medications is incredible. I don't know how you do it, but thank you.
Thank you.
I have some great questions. Thank you all that have been sending in these questions, and being the nerd that I am, I have them color coded here for Amanda and color coded for Seamus, and I'll just kind of go back and forth just to kind of mix it up. But the first question I have is actually for both of you. Rita had asked, is the PowerPoint, are your PowerPoints going to be available? Would you be willing to share your PowerPoints for everyone, since there was such great information in there?
Yeah, certainly.
Sure can.
Okay. So if you guys, perhaps after the presentation, sometime today or tomorrow, could email those to me, I could put that in a form of a PDF, and I have everyone's email addresses, and I can go ahead and email that out to everybody that was on the call.
Sure.
Awesome, thank you. Okay, so this one is for probably for Seamus. What systems are in place at Walgreens or other pharmacies to check for contradictions? I know you touched briefly on that.
Mm-hmm. So there's obviously myself, as I've learned a lot of things, and in general, certain drugs stand out. You see, a run-of-the-mill blood pressure medication come through, and I don't really think twice about that one. They're very often not issues, but then another drug comes through, and that has interactions with everything. So that in itself is, I'm the first line, I guess, but the computer system as well is linked to what we call like a drug information database. And, obviously I don't have all the information stored in my head. So if you came in and asked me a question about, do my 8 drugs interact with each other? Or if I want to add this medication to it, I'm going to look up in my clinical resources with Jason, and then they grade things based on what we'd say like an A, B, C, D rating, and then a category X, which is basically like an absolute contraindication. These medications really should not be used together in any circumstances unless there's really good reasoning and we've tried everything prior to it. So that's what kind of resource I guess we have. When I'm verifying, you get a new prescription in your comes in from your doctor. I verify that the prescription is accurate, and then it automatically runs it through that system and then kicks it back to me if there's a flag for a potential interaction. And so I would say the majority of interactions are not significant, or they're not, I would say, too much cause for concern, and I have to override, hundreds of these every single day. But there are ones, I would say probably about maybe 15 or 20 every single day that I either need to reach out to the doctor to clarify that there's an issue with something, or that they're aware of another issue, or counsel the patient when they come in to pick it up, that, this is what to look out for, and so on and so forth.
Excellent, thank you.
Does that answer the question? I'm saying?
For sure, thank you. Amanda,
Yes.
is shuffling a normal process in aging, or is it a bad habit?
Well, it depends. It can be a sign of a neurological condition such as Parkinson's, but ideally you should not be shuffling. It's not safe. You're not picking up your feet, so your feet can catch on things. So we do have a tendency to see it more in the elderly population rather than young people, but that doesn't mean that you should be doing it. If that answers the question appropriate.
For sure. Thank you.
Mm-hmm.
Seamus, back to you. This is regarding blood pressure medications and taking with and without food or lots of water. There was a story here. I had a morning that I kept getting up dizzy and found my blood pressure to be very low. Would that have something to do with not enough food or water?
I mean, potentially. There's a lot of things at play. I'm not sure. Are they saying that they check their blood pressure in the morning before they took the medication, or not? For the most part, blood pressure medications wouldn't really matter with or without food. There's not any of those that are particularly sensitive to that. So I guess, if your blood pressure is consistently low, then that's something to talk to your doctor about. And I always recommend everyone who comes in to get their blood pressure checked, I recommend they get a meter to take it at home, because that's a much better. You come into your doctor's office one day, they take one little snapshot of your blood pressure. You could have, you're anxious, you have white coat hypertension, as they call it, and they're going to ramp up your dosage potentially, which does happen. But then you go home and you're relaxed, and now you're bottoming out and you're too low. And so I'd always recommend taking it every day. And if it's consistently low, that's something to talk to your doctor about and consider reducing dosages. One thing about dosing morning or nighttime, there's particular drugs, is what we call the diuretics or the water pills. You want to take those earlier in the day, as you take that in the evening, you're going to be getting up in the middle of the night having to go to the bathroom, as it increases your frequency and amount that you urinate. So that's just one, I guess, note as well on that.
Excellent. That's really good advice. Amanda, you touched on using stairs to help yourself up from a fall. Can you talk a little bit more about that?
Sure can. Yeah, so if you are finding yourself in a situation where you fall and you're on the ground and you need to use the stairs to help yourself up off the ground, I actually have a stair here, so it might be easier if I can just demonstrate rather than word vomiting it to you guys. So let's see here. There's a stair right here. Pretend this is your stairs at home. You're on the ground. You're gonna scoot yourself back to the stairs if you can. And you're going to use your hands to lift yourself up on the stair. Another option is imagining that there's a staircase here. You would use it the same way you would the chair. So you would use it the same way as far as like you would get in that half kneeling position and then lift yourself up forward on the stairs where you're kind of walking your hands up onto the stairs until you're standing up. So there's two kind of options for doing that depending on what you're most comfortable with.
Excellent. Excellent.
No problem.
Hey, Seamus, are there recommended doses for melatonin if you are if you're going to try to assist with sleeping?
Mm-hmm. It comes in a variety of different strengths over the counter, 1s, 2s, 5, 10 milligram. I generally recommend starting somewhere in the middle to the lower end of that and see where that gets you. If after a couple days to a week of trying, let's say 3 milligrams, you're not really seeing any improvement, then bump it up to 5, and from 5 you could go all the way up to 10. For the most part, you can't take too much of it. You just be very, very sleepy and knock yourself out, but it's not something that is as dangerous, I guess, as doubling up on one of the prescription sleep medications, for instance. I mentioned before, the biggest issue people find with melatonin is that they either develop a tolerance to it because as you replace it, what your body was naturally producing, your body produces less. And then you become a little bit dependent on it where you can't sleep without it because your body's used to not making it. But yeah, start at the middle to the low end and just work yourself up from there.
Excellent, thank you. Amanda, can you recommend exercises specific to improving balance?
Yes, I can. It depends on your function. So I would say that the best way for me to kind of give a person exercises is based off of their level of activity and where they're at, because everyone is kind of in a different position. I'm leery of giving a blanketed exercise for everyone because what's safe for one person may not be safe for another. So yes, ideally you would be practicing your balance nearby a counter or like something stable again, where you can practice maybe starting with standing with your feet together or then putting your feet like heel toe and standing like that for a little bit. But again, I'm leery of giving any particular exercises without knowing where the person that I'm dealing with is at in their process, because like I said, what's safe for one person may not be safe for another. So if you feel like you are unsure of what exercises you should be doing, you're more than welcome to call my clinic or somewhere else that if you have somewhere that you'd prefer to go. But we are here as a resource, absolutely. So we can, I know that's a little vague and I hate to be that way, but I don't feel comfortable necessarily giving a bunch of exercises out to people if I don't know where their level is.
Sure, that makes sense. Seamus, taking over-the-counter vitamin D, should your physician be monitoring your vitamin D levels? What might be a side effect if I take too much?
So generally, the over-the-counter strengths are one. I think it comes up to a 5,000, excuse me, unit capsule. If you're just doing a 1,000 or taking a vitamin D, calcium type supplement, don't know if it's necessary that the physician monitors the level. The biggest thing, though, I would caution against is that if the level goes too high, that can be very dangerous. Vitamin D is one of the, what we call like the non-water soluble vitamins. In other words, you see vitamin C advertised as something to take before a cold or things like that. And you could take grams and grams of that and you're just going to urinate the excess out. Whereas vitamin D is a fat soluble, it stores up in the body, and so it can reach a toxic level. Effects of too high, I can't actually quite remember off the top of my head. Let me just quickly look up something here. Yeah, so one thing that can potentially happen from it, I'd mentioned earlier, is that vitamin D assists in calcium absorption. So if you have too much, you get too much calcium as a result as well, and you can get hypercalcemia, or too high calcium levels. That in turn can have a whole host of problems, particularly on your heart, as calcium is involved in the muscle contractions in the heart, but also, I guess, symptoms of that outside would be nausea, vomiting, weakness, frequent urination, things like that. Calcium stones in the urine, kind of non-specific, but I would say at the same time, it's very, very rare that someone would take too much vitamin D. I forget the numbers now, but a very, very large percentage of the population, especially in the northern latitudes, is vitamin D deficient, and it would take an extraordinary amount every day or week to reach a level where you have a toxicity situation. So generally 1,000 to even 5,000 units a day, you're still unlikely to have issues, but I wouldn't necessarily recommend 5,000 a day without consulting with the doctor first, just to have a baseline of where you're at before you started or early on when you started taking it.
Great, thank you. Just a couple more questions left. Amanda, Dr. Shah mentioned that using an assistive device like a cane or walker can help if you have balance concerns. Can you explain how to use them?
Sure. So one of the most important things is to make sure that your assistive device, whether that's a walker or a cane, is the right height for you. Your physical therapist can help you with that, or you can just check it at home. It's relatively easy. You want to make sure that when you're standing, let's see if you can see me. When you're standing, your assistive device stops at where your wrist crease is. So this part of your wrist right here, right above your palm, where you go and flex and you see all those little wrinkles in your wrist, you want your assistive device, the handle of it, to rest right there. So that's really important to make sure that you have that set up appropriately, because if you're using something that's too short or too tall, it can affect your posture. So that's first and foremost. The second most important thing is making sure that you're using, if it's a walker, not so much, but if it's a cane, you want to make sure that it's in the right hand. So not like your right hand, but the correct hand. So if you have a side that is affected as far as maybe more weakness or pain, you actually want to use the cane in the opposite hand of the affected side. A lot of people try and you say, my left foot hurts. They want to use the cane in the left hand because they think that that's what's supposed to help. But actually, you want to actually use it in the right hand so that when you're bringing your left foot forward, you're using your right hand to offload that weight. So that's something to keep in mind. Also, when you are using a walker, I see so many people that are pushing it out in front of them and they're kind of leaning over the walker rather than being inside the walker. So there are different sizes of walkers and widths. There are ones that are a little bit wider and ones that are a little bit more narrow. So depending on your build, it might be beneficial for you to make sure that you have one that's the right size. So that being said, keeping your feet inside the walker, walking inside the walker rather than keeping your body out, pushed out in front of you, almost like you're pushing a grocery cart. You want to make sure that it's up nice and close to you. Also, I would say that if you are going up and down curbs or stairs, there are specific ways that you should be using your cane or your walker to make sure that you're safe. If there's a handrail, even if say the handrail's on the right side and you use your cane in the right side, for that instance, you would switch your cane over to the left and use the handrail on the right and then go up the stairs that way. There are specific sequencings and things of how we would train someone to do that in physical therapy. So if you feel like you're not exactly sure, how to use your assistive device, that's something that PT can help you with. But those are all things to keep in mind. First and foremost, making sure it's fitting you properly.
Awesome. Thank you, Amanda. And I know you have a patient at 2:45.
I do.
Go right ahead. I have one more question. It has to deal with insurance, but I know Michelle is on the line. I know she can answer it.
Perfect. Thank you so much. Thank you for having me, everyone.
All right. Great job, Amanda. Thank you.
Thank you. Bye.
So Michelle, the question, I know you're up to speed on this. The question was about the new law and how you can see a physical therapist without a doctor's referral. How does that work with regard to insurance?
Can you guys hear me?
Yes.
Okay, it's absolutely the exact same as if you went to the doctor first. So if you have insurance coverage for physical therapy, whether it's Medicare or a private insurance company, it will be covered exactly the same as if you had a prescription from the doctor.
Excellent. Thank you. That's all the questions that came through in the chat box. Does anyone have any questions here and now verbally? Okay, great. Again, Amanda and Seamus were kind enough to share their PowerPoint. So when they send them, I will certainly send that out to everyone. I'll also check with Dr. Shah to see if he would be willing to share his PowerPoint deck as well. And then that way I can send out potentially all three of them in the same email to everyone. So my last thing that I have just to wrap up, please watch for information through the Village, through our Safe Community Coalition with regard to some of our programs that come through our older adult falls prevention program and task group. We do have two great evidence-based older adult falls prevention programs. One is A Matter of Balance, and the other one is Fit and Strong. And a lot of the things that Dr. Shah and Seamus and Amanda talked about today are also talked about in those programs as well. So hopefully when we get back to normal and can start meeting in person and do some of this programming, for those that have not yet signed up for those programs, you'll have an opportunity to do so and even get more information about preventing falls. So again, thank you guys so much on behalf of the Village, our Safe Communities Coalition, and our Older Adult Falls Prevention Task Group. Thank you so much for your participation. And of course, thank you to our presenters. We really appreciate it.
Thank you for having me.
Yeah.
Take care, everyone.